A Wooster school decided to close their doors because of illness to deal with a growing number of students and staff.
It's a trend that we've been seeing across Northeast Ohio as of late. Elizabeth Van Mitri went to Wooster today to see what went into making that decision and how they plan to use the days off to ensure their community stays well.
It's very quiet for a Wednesday at Wooster Christian School. No winter coats, no school supplies on the tables, no students. Just this sign posted. School closed till Tuesday to illness and previously scheduled holiday.
Please help us, God, and get it off.
Instead, staff is deep cleaning everything. The announcement was sent to parents around 2:30 on Tuesday and told to students over the intercom before their last period.
Did they cheer?
There was some cheering.
A similar reaction Abby Rutt had. One of her 3 kids had already been out this week.
We were home, we got the message right at the end of the day, and we were just really, really excited to have the rest of the time off for the week.
This was the first time Wooster Christian has done this.
I can't remember any other time where we would have like 25% of our student body out at one time.
Randy Claes has been an administrator here for a decade. He says while numbers peaked this week, they've noticed issues the past few, and not just one illness in particular.
I did text with Gabe Tudor this morning, the superintendent for Wooster Public Schools. He says the district plans to stay open for now, but they do have an increased number of absences compared to other times of the year.
As for Wooster Christian School, Randy hopes this will break the sickness hitting his students.
Hopefully when people return, the coupled effect of the students being away from each other with the building being cleaned and having a chance to kind of reset itself, we'll be in a better position of being healthy next week.
A decision Abby supports, and she welcomes the opportunity to find other ways to spend their time.
Yeah, for sure, we're gonna get better. We also might have booked a ticket to Florida.
For News 5, I'm Elizabeth Van Mitri.
Oh, we were wondering just how bad the illnesses are, not just in Worcester, but in the entire county. The health department told Elizabeth as of today, they are not seeing any levels of illness that would be considered an outbreak.
And today I did reach back out to a doctor I spoke with last week about the rise in illnesses among children that we just continue to see. And he told me influenza A is really the main troublemaker right now, but RSV, COVID, and norovirus are still circulating as well. He said kids can be sick with more than one at the same time or get them back to back. He also told me it is not too late to get a flu shot, as flu season has yet to peak and respiratory virus season can extend on into the spring.
Certainly, if you haven't gotten the flu shots are very, very safe. They're not 100% effective, but they're pretty effective in preventing flu and making you less sick if you do get infected with flu.
Dr. Sabella told me there's antivirals as well for the flu, which can be really helpful for children who have chronic conditions or are immunocompromised. But you got to act fast to get those on board. He says most healthy kids do really well with a viral infection, with the worst symptoms going away in about 3 to 4 days. But he says that cough can linger. Red flags to look out for: breathing issues. Get in right away. And best, he says, to always protect yourself by good hand washing and staying home if you are actively sick.